Welcome to the office.
What brings you here, Blake?
So, back in January, I got injured while I was riding a bike, doing this thing called the walled cycle.
What's that?
So I have a buddy who's like a vegan fitness guy, and
Okay.
you ride a bike and then you lift 15-pound weights at the same time. And I was
No
getting
hands?
no hands on the bike, just
Obviously.
like that. I was getting shredded, and I hurt my leg because I was actually working out while I was kind of like high. So I was just going hard. And I went the next day to the gym, and I felt pain in my leg here. And I just thought I had leg pain, so I was like stretching it, and it was hurting so bad, just not helping. And so I went to pick up 40-pound weights, and I lifted, and I just heard like and I literally like walked home like all crooked, like this.
You heard one or two times?
Like, honestly, I felt like two, honestly. But it was horrible pain. Like, I laid down that day, and I woke up the next day thinking I'd feel better and shake it off. And I went to get up, and I was like, whoa. And I like had to move like that, you know?
Okay.
So,
This was January, though.
late January. And I didn't go to get MRI until I went to an urgent care clinic to be like, yeah, what's going on? My leg hurts, my back kind of hurts.
Okay.
And he was like, you need to go get an MRI. So I went to get an MRI. And when I did that, it revealed that I had, well, the report said I had 2 slip discs and spinal stenosis and degenerative disc disease. And they prescribed me like drugs and stuff, but I don't take pills. Like, I don't take any.
How old?
I'm 23. Yeah.
23 with 2 slip discs and degenerated disc.
Yeah. And I run
Okay.
every day. Like, I used to run every day of my life and like very active. I travel like around the world all the time. So this like really threw me off. I just didn't know how to deal with it, and I went to see a couple other chiropractors that just didn't really do it for me. I did E-stim therapy. That helped me out. There's a really cool guy.
Gave you
who
some
did it.
pain relief, right?
Really, a lot of. He corrected me. I was walking like this. When I went to him, I was able to walk like this.
Good, okay.
But the main root of the pain in this area, shooting down my leg, just doesn't
Stops
get away.
at the knee or goes to the toes?
It goes down here sometimes, not really my toe.
Okay.
But if it's really sore, it'll go down here if I'm standing too long or if I lean back too much. But when I'm walking, I walk literally like tilted so my body doesn't feel that pain. It's hard to explain.
You don't have to, I already know. Okay,
Yeah.
and we're going to explain what actually mechanically is going on right now.
Okay.
Okay, and I do see it on your film.
Okay.
I do see exactly what it is. So I've been talking about the dimples. These are the PSISs right here and right here. And Blake, yesterday we started something just to make it a little bit more entertaining, okay?
Okay.
So these are the dimples and that's the happy face.
Alright.
No pun intended, okay? Now, go ahead and walk. We're watching these dimples. They should move up and down when he walks, not side to side. They go up and down, but not a lot. So he's very guarded.
And also when I'm walking, I usually am like preserved with my back and curved. Like when I usually stand straight, don't make fun of me.
No, you're
I
good.
have to do it with my hand right now because I can't with my own strength.
Yeah,
This is how I walk into a room, like normally, you know, like
that's how you should.
with a good presence. But I've been like this with like my butt clenched, walking like that to relieve the pain.
So what you've been doing, just so we can talk about it, and it'll all make sense. You're doing an anterior pelvic tilt.
Exactly, all
right?
the time, yeah.
Like this. Sorry. Posterior pelvic tilt.
Posterior, yeah.
Clenching the butt. I'm going through your position right now. It's not fun.
Yeah.
So this is him, and now when he's walking like, I don't want to make fun, but
Dude, I know, it sucks.
this is the walk, okay? And we'll explain why. Okay, let's walk. Keep walking.
Okay.
So it's just a very guarded walk. Do you normally swing your arms though when you walk? Normally you swing your arms, right?
Yeah, my arm's like stuck like this when I walk.
That's what, right now it is.
Yeah, like it seems like it just like stays there. It doesn't sway anymore.
Correct, but we're designed to swing the arms, okay? So yeah, he's got the waddle. We got a little movement in the dimple, then we got the side shift to the left. Right side is stuck high up. causing that external foot flare. He's got ASIN, external foot flare. And then he's just trying to follow through with that left foot, correct?
Yeah, pretty much.
Yeah.
And while I'm walking, I just feel the pain down here the whole time.
All the way down the side, the back
Yeah.
side.
The worst is when I'm not gonna do it, but when I rotate and try to reach for something, brother, that is not it. Like when I get out of the shower, try to grab my towel or something and like turn too much, like I'll just get stuck here with shooting pain and I like can't move.
March in place, knees up high, sir. Okay, I'm gonna have you close your eyes in a second and
Okay.
see where you go. Close your eyes and let's see. This is really interesting. You like that? See, you got me using that word today. I don't like it. Stop. Okay, here's what typically happens.
Okay.
When I have someone close their eyes, they typically go forward from upper cervical and pelvis. You're the
Yeah.
first guy going backwards.
Weird.
Okay? No, it's just a different find. Let's try it again. Just make sure I'm not
Okay.
march in place, knees up high. So typically when I've done this, they go forward. Now, close your eyes. He's coming back to me. I don't have the answer just yet for that, okay, sir?
Okay.
But it's a different finding than what I've seen historically.
Okay.
Okay, come back over here, have a seat. Now, before we start the exam, Blake, is there anything else I need to know?
I had ACL surgery.
Okay, what other surgeries besides that?
I had a septorhinoplasty.
When did you have ACL?
ACL was when I was 18. I had my ACL and MCL. That's the scar right there.
Yep.
It's a little cross because I actually got a scar there when I was younger.
Not the
than I did
meniscus,
surgery.
right?
Well, ACL, MCL, and meniscus.
So the triad of O'Donoghue, they call
Yeah.
it, yeah.
And my high school football coach, I was like a starter that year, and he was like, "I'm gonna get you patched up, buddy," and like he got the Eagles guy to do it for me. So I got a nice cadaver in here. It's never had any problems.
Beautiful. No pin?
No, everything's good up in here. But
Okay.
I did have a septorhinoplasty twice. I had a septoplasty and then a rhinoplasty.
Sinus issues, breathing issues?
I have a deviated septum.
You do.
And it's bad in here, but it doesn't look bad. But I do need to get see an ENT to get that repaired.
Okay.
But
Want me to see if there's anything I can do for it?
sure, if you want.
Okay. We'll take a look at the x-rays and see if anything pops up.
Okay.
Okay. What else? Anything else I need to know? Why are you here?
Dude, I'm in pain. Like,
Come
honestly,
on.
I stress myself out so much and work so hard all the time. Like I always have so much tension. Like I'm just on a laptop doing this, running miles, or doing something just insane, like jumping out of a plane. Literally.
What have you been doing the last 6 months with this?
Nothing.
Just the
I
computer?
can't do anything.
So you're not doing the computer either?
I can barely do the
So
computer.
you're not creating any content either?
Barely.
Either.
Like I can barely create content. I am because I need to stay afloat, but it's just like
Okay.
it's dragging me down. So
Let's get that content up.
yeah, I need
Alright.
to get back to it.
Let's do it. First thing we need to talk about is the foundation. Do we have a level base and foundation here?
Doesn't look like
It
it.
doesn't look like it. So let's talk about what these numbers mean and then go through the principles. Okay?
Okay.
The way the pelvis works, it works they work like this, right? One side goes up, the other side goes down, one side goes in, the other side goes out. In this work, in the Gonstead work, there's a very rare exception that both iliums are the problem and get adjusted. In my 20 years of practice, I've had a double subluxated ilium, a true double subluxated, 2 times in over tens of thousands of people.
So that's super rare.
It's super rare, okay? Now, AS4IN7 with P5-R. So you have what's called, you have the rotated sacrum with a rotated pelvis. So let's follow my thought process. It sits on an angle like this, the pelvis. When it misaligns posterior inferior, the vertical distance will be larger. When it misaligns anterior superior, AS, this way, the vertical distance is smaller.
Okay.
So AS is the absolute difference here. I did mark this pelvis on the right. Based on this work, it goes according to the lowest lumbar body rotation. So AS4 and IN rotation this way towards the right of 7. So let's put that part together. This right side goes up and in. If the right is up, the left is down. If the right goes in, the left is out. It's the right. Now, you also have a rotated sacrum on that side. 2 separate injuries. What the book tells us, for those guys out there, it's the chapters, Gonstead chapters, page 43. Which to adjust first. There's actually a rule we follow.
Okay.
Or a guideline. So if you have a rotated sacrum on the side of an ASIN or ASIN, we're going to start on the sacrum.
Okay.
If this was a PI, down and out, we would have, the book tells us, start on the pelvis. And that's only for a start. Okay? Does that make sense so far?
It makes sense.
Okay.
So it's the sacrum and the pelvis.
So the sacrum is rotated back on the right, the pelvis goes up and this. So your body favors which way?
That's
Always to the right.
Yeah.
And it's going right. What's it doing at your mid-back? It's
And
compensating.
honestly, yeah.
Because it's got to come back. But then what is it doing here again?
Going
Got it.
back
It
up.
has to come back. So
Does not look okay.
this part of your body is compensating for this. This part of the body is adrenals, kidney, energy, chi, all of that. T9, 10, 11, 12.
Because I feel sore there all the time.
Correct.
Because that's probably because of that.
But that's not your cause.
No.
I'll explain when I get here. But follow my process. So you're clear here. Now, let's start with the foundation. If this is our level base, first one to go off is 5. 4 goes with it, 3 goes with it, 2 goes with it, 1 comes back. Next one, 12. Sorry, 12 is level with that. 11, 10. From 10, the next one to go off is 9. 9 takes, 8 with it, 9 takes, 8 with it, 7 with it,
And it turns
6, 5 comes back.
Mm.
4, 3, and then 2 side slip. So 2T, 9T, maybe 12T, 5L. Those are the potentials. Okay? I still have to find it on you, but it's going to be one of those.
Okay.
Or maybe all of them. 5th lumbar, 12th thoracic, 9th and 2nd. All of this is secondary to what? The pelvis and the sacrum. Now, I want you to see this also. I'm going to erase all this now, just so you can see the tailbone I'm talking about. You get all this, right?
Yeah, now that I'm thinking about it, I did hurt my tailbone when I was younger, but I just thought it was a little, like a bruise.
Look, let's go over here. So, the tailbone, we should have a smooth arc like this, okay? You got a bent sacrum.
Yeah.
And you got a nub here, you got a nub there, but that's the big nub. But here's what I want you to see. You brought me an MRI, dude.
Yeah.
I need you to see the difference, okay? I need you to see the difference in the shape even of the sacrum. The spine is a weight-bearing structure, right, Blake?
Mm-hmm. So
mechanical imaging should be weight-bearing. Non-weight-bearing is great for fractures and tumors. Okay? So look at the bend there. Let me bring the laptop over here. That's straight, but look here. You don't see the whole thing as such, but it looks like it's curving here, right?
Mm-hmm.
That's S1, that's S2. L5, L4, yes, okay, I see it. I see it. Now, let's explain it. You have an open disc in the back on 4 and 5. That is worse than having it closed in the back, which is typical with a herniated disc. Follow my process. So, in the functional spinal unit, we have the bone, the disc, the bone. 2 parts of the disc, the nucleus, that's the pivot, the ball bearing. This is the annulus that holds the pivot. The function of the pivot is to do what? 6 degrees of motion. We misalign, lose 1 or all 6 degrees of motion. But here's what I need you to see. 4, 5, lumbar spine. Look at the mechanics. There's only 1 to 2 degrees of rotation there.
Yeah.
The way it misaligns first is posterior. If it goes off the nucleus, it's typically going to go down. Yours went up. That's more severe.
That's probably because I was lifting the weights like this when I went up.
And you curved back.
Exactly.
Yes, but I'm trying to show you something. You have an open disc at the back. Your MRI shows it closed.
Okay.
That's what I'm trying to explain, guys. So if you look here, it looks closed. It's not. Okay, so this is 4, this is 5. I'm pointing this out for a very specific reason. Open. Whenever we have a disc open in the back, this is your answer now. And this is in the Gonstead work, guys. You guys know this, the difference between a BP sacrum and a fifth lumbar retrolisthesis. My Gonstead guys know this. When the vertebrae misaligns on L5 back and down, retro, the fix is L5.
Mm-hmm.
When it's open in the back, you got to bring the vertebrae below up. It's not L4, L5. Your answer is S1, S2.
That's where the pain's coming from in my leg, huh?
Correct. Okay?
Oh.
Follow my process. So while this shows, look, good signal intensity of your disc, low signal intensity because there's no movement.
Yeah.
Now, follow my next process, sir. When you go for an image, we actually send to a seated MRI here. Global motion, intersegmental motion. Every bone has been quantified to move a certain amount. Intersegmental motion, global motion is I'm moving my whole spine. Okay. If one segment gets stuck, or even 2, 3, 4, 5 segments become hypermobile to compensate. The stuck segment doesn't move. The hypermobile segments move. Going backwards because they're hypermobile.
So this being open right here, is that making this all squished up?
Well, that's also open in the back.
Really?
They're both open in the back.
Oh.
That's what I've never seen before. I've seen an L5 open in the back. Yours are both. Regardless, we ain't touching those right now anyway.
Okay.
We're down here.
Okay.
We're not touching that stuff.
What is that right there?
That's an old tailbone injury.
That is, isn't it?
Yeah. So the sacrum has 5 segments that fuse at that ossify at 32. So here's your good news. You're how old again?
23. I'm super healthy too. I really am.
So you have a potential to remodel.
Okay.
Okay, that's the point.
That's good.
That's the
the
point.
news I need.
That's
today,
the
brother.
point.
That's the news.
S1, S2, 3, 4, 5, coccyx. S2, possibly S3. That's your fix. This is circles, circles, circles. It's not degeneration, dude. It's because of the tilting, the twisting. You're you're looking at the bone like this.
Yeah.
You see how I've marked it down there? I've been doing that for 20 years. Because I have to explain that to everybody, dude. All twisted, twisted. Those are your fun dives. This is your digestion. 6. That's all your digestion, fun stuff, undigested food. 5, 4, 3, 2, good. 1, good. 7. Your discs are fantastic. And if I just did this, here's the best news for you. You have a textbook neck, my brother.
Really?
It's just forward.
That's all he told me. He said my neck is forward, so I should go like this.
But your neck is textbook. It just needs to be behind, on top of the foundation.
Yeah.
But the curve is good.
Okay.
That's your blessing. That's the good news. Your
Nice.
discs are good in your low back. You have some stuff in here. I'm not worried about it.
Okay.
Okay? Now, TMJ, right TMJ. Am I boring you yet?
No, not at all. This
All
is
right.
all stuff I wanted to learn.
So, as you open your jaw, it should be right side goes down, left side compensates the other way to bring it back midline. All of this, though, could be secondary to something in your upper cervical.
Okay.
but we won't know until I actually check you.
Gotcha.
So put it together. Foundation, rotated sacrum, pelvis. We're not starting there. I don't see it yet. We're probably starting somewhere here. Let's see what we find. I probably wouldn't touch this area. I would be okay doing down here and anything above T9.
Okay, yeah, because this area is super sore all the time. And honestly, I'm usually like really lean and like when I like even like take a photo or something, like I'm lean here, it's like super swollen back here on both sides. So I'm guessing that's a result of what's going on.
Does that make sense?
That makes perfect sense. Thanks for explaining it in detail.
You got it. Can we get started?
Yeah, let's run.
Now the fun. Sit up straight, please. So even sitting, you can see, but I cannot get extension. Sit whatever's normal, comfortable for you right now. Okay, so from here, you can see this block right there. And this block, we need to get that curve. Okay.
Yeah, this is how I used to walk.
Okay, we need to get that curve in. So sit whatever's comfortable and let's run the meter. Just feeling overall body temperature. You can see creases higher there from the pelvic misalignment, lower here. Dimple is higher on the right than the left. Starting at the base of the neck. And the first thing we're getting is 18 points, C1, left side. Needle sticking all the way left side, all the way down to, interesting, let's do that again. So it looked like it was gonna break here at around T9, but it didn't break, it just swung and continued, oh, there it is. You're the stomach sleeper, you said, right?
Yeah, I sleep on my side and my stomach with like my left leg hiked up on a pillow.
Okay, so I'm getting the T12 area. T9, this looks like compensation in this area here, but this, so it's kind of just doing this right now. And then
Yeah.
it stops right there.
It's like a snake.
Correct. Okay. Right side. Now here's what's going to be interesting. I'm going to do this 4 or 5 times. The needle's going to shift to the left. Watch. There it is. S2, left side. That's so crazy. Yep, S2, even S3. Starting right there, sir. S2, S3, around T12, L1, and C1. 1, 2, 3. Feet together. Open and close the knees, please. Open and close. Open and close. A little faster, sir. Thank you. Right side only. Good. Left side only. Yeah, so when he does the left, the whole right wants to shift with him. When he does the right side only, the left is independent. To the right side, please. There's a little pull of the muscle, but that's fine. Let's start down here. So this is your L5.
Okay.
Tender.
Yeah.
That's your L4. I know it's tender.
Mm-hmm.
That's L5. Tender. Now let's go down. S1. Sharp, right?
Yeah.
S2.
Ooh, dude. Ooh, that was sharp.
All right. S3. One more.
Oh, okay.
Okay. What more can I say?
Oh.
S3. One more, sir. Not as bad as S4. Starts at.
Oh, wow.
Sorry, brother, but
it's
I
all
have to,
good.
I have to show
all
you.
good,
Okay.
Mm-hmm.
Where is it starting?
S3.
Thank you.
Yeah, for sure.
For sure. Static palpation, running my fingers down the spine. So you can see right there is the orange peel. That's the swelling and edema right there. That's 5, 4, 3, 2, 1, that's 12. You do feel that, right?
Mm-hmm.
3, 2.
Ooh.
Head down, slowness. That's all coming from that ceiling. So what did you get out of our exam and findings?
What I got out of the exam is that the foundation is messed up from the sacrum and the pelvis,
Yes.
and it's an anterior on the right side, right?
Pelvis is anterior.
Pelvis anterior, and then the sacrum is
Rotated. on the
rotated,
side, yeah.
and that's causing pain to the sciatica root, which is giving me all that pain. And then basically the rest of my body is compensating for that misalignment, I guess, for lack of a better term, from the sacrum and the pelvis. So I literally am like walking around with like a swiney back.
Where did we find the major pressure? Was it L4, L5?
No, the pressure. Remember, like I have the disc slip at L4-5, but all the pain's coming from S3, which is sacrum.
S3, sacral.
Yeah, and I have a previous tailbone. My tailbone's supposed to go like that, and it just goes like that.
So instead of a curve, he's got a hard.
That's why you guys been saying I've been walking like that.
So he'd be walking like this, right?
Yeah. Oh yeah.
That's him, right?
Yeah.
All right. You can handle it, right?
Sure, let's
Do
try.
you want me to be nice now or do my job?
Get the job done, yeah.
All right.
Yeah.
And the low back is the last thing I'm going to do, because once we do that, we don't want you sitting. Gotcha. Hold on. Give that a second. Take in a couple of
Oh my God.
Give me a couple of nice deep breaths.
I feel like I'm in a different body here up. Like a different head.
Stand up and walk. Let's see what's different just from that. Tell me what's different just from that. Still have work to do.
Wow. It honestly feels like, you know when you have a rusty chain on a bike and you throw WD-40 on it?
Yeah.
Oh dude, I'm flowing.
Alright, good. Let's go left side down.
This is awesome.
Left side down, sir.
So this is what chiropractor's supposed to be like.
Well, there's one reason, you know, there's this was taught to me in school. Not in school, but when I was in school. There's only one reason we have chiropractors on this planet.
Why not?
One reason. It's called the subluxation, the vertebral subluxation complex.
Yeah.
And the subluxation, by definition, that's how we started. It's what I'm doing for you.
Yeah.
Subluxation is a very simple, well, I'm going to give you the simple definition. It's a spinal shift where the bone shifts off the nucleus, causes swelling of the disc that put irritation on the nerve. Wherever that nerve goes, there's some sort of loss of function.
Disease.
And the job of the chiropractor is to find that. Everything else you can get anywhere else.
Yeah.
Tuck forward. Forward. Full body forward.
Oh.
Whoa. Okay.
Okay, hold on.
No problem. You take your time.
Okay.
You tell me you're ready.
I'm ready.
Okay. Let's do
Am
it.
I tucked forward enough?
You're good.
Okay.
You okay there?
Yeah.
Okay. It's got to be quick, guys. Quick. This is not about brutal force, okay? 1, 2. That's 3. Gonna get the cobra. You're gonna get the cobra. That's 3. Okay. Is that good there?
Yeah.
Breathe. You're thinking way too much. Close your eyes for me, sir. Happy space, please. Happy space, brother. And I will need to push this up. Are you okay with that?
Yeah.
Shoulders okay? Gotcha.
Oh.
Home run. Come look at him. Look at his face.
He said home run.
That's the home run.
Can I get up?
Not yet. Give it a second.
Okay.
You okay? Push
Yeah.
yourself up. Push yourself up. Swing your legs down. Dr. Gonstead used to say, get up like a cow, not a horse.
Okay.
Stand up and walk. Check it out. Good stuff there.
feel like I'm walking with my foot more forward.
I'm not saying nothing right now. I'm just letting you walk. I'm just letting you walk. 3 more times. Yeah, dude, you're not twisted on that right foot as much.
Yeah, I'm not.
And we didn't touch the pelvis yet. It's gonna feel weird, but here's the cool part. Guess what you get to do today?
What's that?
You get to buy some new shoes if you don't have a pair of new ones. New shoes, why? We're changing alignment, don't wear the same tires.
Okay.
Should feel different in your walk.
It feels drastically different, honestly. Like, I'm not just saying that.
Well, you're actually swinging a little bit of your arms without even mentioning it.
That's why I feel good. Like, I can do this. I'm not walking like this.
Right?
So
that block is already half. Remember that block?
Mm-hmm.
Go into extension, sit up straight. That's fine. Starting at the base, let's see what cleared. Neck is 0. T12 is clear. Didn't have to touch it. Cool. Everything S3 is 0. Check this out. Back slowly towards me. This is 5. Okay?
I haven't done that in months. I'm serious. I have not leaned my back like that in months.
S1. Check it out.
Oh my gosh.
S2. Check it out. Keep going, dude. You got it. You got it. You got it. That's
Okay.
it. S3 is the scream, though, right?
Yeah.
Tell me.
Okay, I feel it there.
Okay. No problem. But definitely a lot more extension, yes?
100%.
Okay. Right side. How's the twist? Give me a high five back here. Give me a high five back here. Well, you said this was an issue, right?
Yeah, it was.
Grab this here.
Okay.
Any twinging in the back?
No.
Okay, grab it on this side.
Nothing at all.
Nice. Okay, I'll take that. Can I continue?
Yeah.
Ears.
Yes, those are my ears.
Shoulders.
Whoa.
Shoulders. On your back.
Crazy, dude.
Time for your feet. Now, I'm using the board just to get the ankles moving.
Okay, this is super.
I got it. How about here?
No.
That's it. Bend the knee.
Okay.
Sit up for me. Let's do a bump and polish. Let's get rolling. Okay. Now the fun part.
All right. Oh man.
His legs are straighter.
I'm not stiff. I don't feel like my leg has to go out anymore.
Mm-hmm.
And overall, I just am like flowing.
Squeeze.
Okay.
That's it. Squeeze. We have a radial head and humerus. Squeeze hard. I'm checking all the bones.
Okay.
Squeeze. Here we have an ulna. Straight.
Mm-hmm.
Straight. There. Posterior humerus. Posterior radius. And lunate. Squeeze hard. Squeeze hard. Not shake.
Alright.
So this,
My bad,
just
my bad,
this,
my bad, my
and
bad.
squeeze.
Okay.
Squeeze. Thank you. Squeeze. Solid on your back. And what we can see is this. This is the nasal bone.
Yeah.
Nasal bone. Septum is?
I have a perforation in there though, so like it's like a hole I can touch my fingers in my. There's no line in the middle.
In here, right?
Like I can touch my fingers.
Where? In the septum.
Yeah.
Okay.
Right there, yeah.
I'm focusing on the connection between the septum and the bone.
Okay.
I'm not messing with that stuff.
Okay.
And I'll explain what I'm doing before that's right there. That's what I feel. It's stuck on that side.
It is.
That side is okay.
Yeah.
You feel that?
Yeah, but I'm trying to let you know there's literally a hole in there.
I understand. So here's what I'm saying is,
Okay.
okay, that's your septum. It's bent on this left side. You have a hole there. You're saying a perforation.
Like I can touch my fingers, yeah.
I understand. But what I'm saying is it's still bent here.
Okay.
So regardless of a perforation here, it's bent here.
Okay.
I'm working on the bend, not that.
Sounds good.
Cool?
Mm-hmm.
Let's do it.
Yeah, as long as it's not gonna do anything bad.
Chin down, sir. Chin down all the way. Look down, down. I'm gonna grab the nostrils like this. I'm gonna pull them over and I'm just here on the septum, light. That's the move. That's it. Gotcha. Walk it off. Look at his back, the swelling is half gone already.
Dude, I feel great.
Pretty cool. Okay. That's where I'm gonna start with you, sir. Any change in the breath?
Yeah, I'm breathing more clearly.
Questions?
Nah, dude, thank you so much. Seriously.
Welcome to the office.
Thank you.
I'll see you in a couple of days.
Sounds good.
This is visit 3.
Yes.
We did not do a follow-up on visit 2. We're a little busy, but let's see. Tell us what's different today from our first visit.
So different today from first visit. I don't have problems with clenching my sacrum and like leaning my body forward here.
So you're not doing this as much?
No, not really.
Okay.
Which has been nice and taken a lot of pressure off of my body.
Okay.
The only thing that I'm really experiencing is like just the like severe sciatica pain.
Has that changed?
It did get like a little bit worse last night.
Okay.
I was walking around, moving around.
Okay.
I think it was just because like I wasn't sure how to move.
Say that one more time. What do you mean you're not sure how to move?
Like I wasn't sure if I should keep my back straight or if I should slouch. And then it just ended up getting kind of uncomfortable with like certain positions and moving around. So
Okay.
yeah, so that's really it. But other than that, the clenching forward, like that's a lot better. The only problem I'm really having is with that
Okay.
leg, that sciatica.
Let's see what we find today then, okay, Blake?
I do feel some soreness behind the SI joint too, right here.
Okay. And we know that this is an area we do need to address. Let's see, if we're 0 on the sacrum, L5, we can go to the pelvis.
Okay.
Or we'll make a decision what we're going to do here today.
Okay.
Okay? How is shoulder? Shoulders, arms, all that's good?
Yeah, all this feels good. Feels good, yeah.
Yeah? Okay. All right. So we're a little red on the scoping today. A little extra water, please, Blake.
Mm-hmm.
Little 5-pointer left up top. C1 left side, 5 points. Yeah, that's T9. C1, 5 points left side, T9, 10 points left side. Oh, guess what?
What's that?
You 0 here today, sir.
Oh,
You know what that means?
Oh, man.
Pelvis today. You asked for it. You don't get it now. Sacrum is 0 today, sir. Beautiful. Okay, so we have T9, C1. Now let's check the pelvis. Scoot forward, please. Feet together. Open and close the knees. Open and close. Good. Good. Left side only. Yeah, you can see the shifting on the end of the right pelvis. Right side only. And when he does the right, left is good. Okay, when you're doing the right side, are you getting any shooting pain down your leg?
No, when I go in, yeah.
let's do that again. Go out first.
Okay, no pain.
Okay, tell me when as you're coming in.
There.
There, okay. Now do it again. I'm going to put my finger here.
Okay.
Open the right leg.
Mm-hmm.
Close it. Tell me if it's the same or better.
Same.
Same. Okay, open again, please.
Mm-hmm.
So for an ASIN, I'm going to be at the bottom here. Okay.
Oh yeah, I feel a lot of pain.
Okay. Local or shooting?
Local. No, shooting down.
Okay. We're at your right pelvis today, sir. Let's see the leg again.
That's like as far as I can go.
Hold on. That's Hunt. Sit back for me, please.
Okay.
Bring your leg up. Is that okay on your hip when I did that?
I can do this, like, very well.
Okay.
But when it comes to extending this is the worst pain.
Okay.
All up in there. Oh, yeah, that's just rough.
Okay. That's posterior tibia, posterior fib. That's a posterior fibula, dude.
What's that?
The fibula bone. That thing ain't moving. Hold on. I'll explain it in a second.
Okay.
How's that back?
Mm.
Okay. Go on your back. I need to test. We got a whole new mix today, sir.
Oh, man.
On your back. I need to do some patellar tracking of your right knee. Let me do the work, please.
Oh, okay.
Can we bend a little?
Mm-hmm.
Okay. Straight. Okay. Straight. Okay. So what I'm feeling first is the tracking of the patella. And there's a click right there. Now, right there.
Yeah,
You feel
I
it in
feel
the
it
backside.
I'm going to feel it here and here.
Okay, so the hamstring from here all the way. Now, does it stop there? Bear with me, okay? That one more?
Both of them. Both of them, yeah.
Okay.
It hits both those areas all the time. It's the most annoying thing.
Okay, so we actually have to deal with your knee today.
Okay.
We got a little extra work to do. Let's do this one just to check for symmetry.
I feel pain in this side when you do that, but no pain in this side.
Just finger pressure.
Yeah, that doesn't hurt anything.
Okay, bend the knee. All right. C6, C5, 4, 3, 2. We're going to wait on that one up top.
Okay.
We're going to do T9. We're going to do your right pelvis. After that, I'm going to have you walk once. Then we need to start on the knee. You may have seen me do it. It's that knee pull move. But I have to take lotion first, and I really got to work that capsule out as much as you're going to let me.
Okay, because I did have ACL surgery here. You can see the
Yep.
scars.
Yep. No problem. Now, the surgery was a while back.
I was 18, yeah.
Yeah, that's all healed
I've
up.
been running on it for years.
Yeah, so I mean, that's all healed up. The main thing is the alignment, and let me show you on the knee model so you understand.
Okay.
The knee is this, the knee complex. This is the right. Let's do it this way.
Because my initial pain in January started here.
At the knee.
There was no pain anywhere other than here.
Okay.
At first, there was no back pain. I hurt my back after I hurt this.
You felt your back after
I felt my back pain
after you heard the knee.
Exactly, and that's why I figured out that it was all contributing.
Right, and the pelvis and the sacrum will contribute to the knee.
Gotcha.
Okay, now let's explain this foot model and see, it should make sense. This is the femur bone on top, this is the tibia on the bottom. The fibula is that piece, that stabilizing bone on the outside.
Mm-hmm.
Okay, now when I'm looking at the tracking, it should track smooth like this. If we have any alignment issue of femur or tibia, we get that little click. So we are getting a little bit of that click. And what you're feeling is, we call it you have a bulge of the posterior lateral capsule
Okay.
and the meniscus. So the fix today is going to be this. I'm going to have to really work that swelling back in. Then we're going to bend the knee, and I need to do this. It's rotated back. I need to pull it forward.
Okay.
Okay, so I need to do the tibia and the fibula. Those two today. So from the PSIS, 1, 2 inches lateral, 1, 2, 3 inches inferior. That's going to be right there. That's the worst of it right there.
Okay.
The contact is going to be like this. I'm not thrusting, I'm just showing you. And we're pushing it. Hold your wrist firm, dude. This way, like that. Pelvis down, out.
Okay.
We're not up here.
So it's not, okay.
Okay?
The only thing I was worried about was the pain behind the knee being affected. It doesn't seem like it's going to be affected here.
You okay with that on the knee?
Yeah.
Gotcha. That's the worst of it.
That's it?
Come on up. He's like, what the hell just happened? I had to just get in. Let's walk it off. Walk several times back and forth. It's a little different.
Feels like new.
Dude, check it out. Watch the dimple on the right. It's starting to move now.
I think I got my sweater up there. Yes, dude.
New watch alert.
You watch it.
Just keep walking, bro. Just for giggles. Bend the knee.
What? I'm blowing. I can move this bad boy around.
Let's walk.
That's awesome.
All right. New spine alert. New spine. Nice. Let's go on the gray table now, please.
Okay.
Down, please. All the way down. Down, down. Shoulders down, hands down, please. There you go. There we go. 4, 5, 6, 7, 8, 9. Now, this is something new I'm about to do, okay? Not the adjustment. I'm just doing this. Gotcha.
What was that?
T9, adrenals, energy, eyes, light sensitivity, the B button. You been all right?
Yeah.
You haven't been too moody the last day or two?
Nice, we're good.
Good.
Yeah, we'll be looking better now.
Good.
Got my chest back.
There you go, brother.
I've been walking like this for a long time, bro. I didn't go to the gym for nothing.
Come on, dog. Stick it out. Good. Come back over here, sir. Have a seat, please. Let's continue. Let's see how you're sitting now. Nice. Good. Let's run the meter. That cleared up the neck. We didn't need to mess with that. Alrighty. T9 is clear. Nice. Nothing disrupted the sacrum. Nice. Scoot forward, sir. Feet together. Open and close the knees, please. There we go. Right side only. Left side. It's not pulling as much now.
Is that good?
It's fantastic. Go on your back. Nice and easy there. Bend. Let's see if there's any difference.
What? That's weird. That's so weird.
Drop this leg. Let him see this. What did you say you couldn't do?
I haven't done that since January.
You just have full extension, brother.
That's insane.
What more you want?
That's great.
So what I was originally going to do, I'm going to do different. I was going to actually pull on it. I'm not. I don't want to disrupt anything we just did. I'm going to use the board for the tibia and the fibula. Okay? And then we'll tune up the ankles and get this show on the road.
Sounds like a plan.
Straighten it up. Look.
Oh, yeah.
That's what you asked for, dude.
I've been waiting to just do that morning yawn like that. You know what I'm talking about? You wake up and you're like,
Isn't that what he just asked for?
I've been doing a left side morning yawn since January.
Let's do it. That's it. Done. That's it.
Oh.
That's it.
That's it?
Look. So let's talk a little bit about energy real quick.
Okay.
Something to think about. Right-sided is our business. You can stay on your back.
Okay.
I'm going to still work on your knee.
Okay.
Right-sided is our professional, our male energy, our business. Left-sided, our female energy, our relationships, personal. Hips, we hold anger. Knees, fear. Shoulders, burden. Okay? Just something to think about. That's all. Now, can you just lift yourself up? Like straighten out? Yeah. How is that when you do that?
Feels fine.
Nothing is twinging when you do that?
No, the only twinges I feel like when I'm laying on my back here is in my butt cheek here.
Okay.
Right by that, because it's been so tender for so long.
Yeah.
And then, right here.
Okay. Now what we need to start doing is I'm working up some of that scar tissue, okay? Your job is the same.
Okay.
Keep walking. So when the fibula goes back posterior, there's a muscle here. It's called the peronei muscle.
It's so sore.
Behind, right? So the peronei muscle starts here, goes down. There's brevis and longus, goes behind the lateral.
That's the exact pain that I've been having.
And I'm sure, you know, people have told you peronei, it's the muscle. It originates though here at the knee, inserts into the ankle. So what I did was the pulley, not the cable. Okay? Check it out. There's movement now, dude.
Yeah.
Okay, now let's bring that up. Go on your stomach. Now I'm going to use the board also for the fibula. Raise your whole right leg up if you can, please.
Like,
Up. No, the whole leg. Can you raise the leg up? Are you okay with that, or is it too much on the knee?
It's not on the knee, it's on this.
Okay, so then keep it down. I'm going to pull it.
Okay.
It's going to be light and quick, all right? We're on the fibula here. Posterior. You're good, dude. I got you. There it is. Good. It's light and easy. That's it. Got it. Okay. He couldn't straighten out his leg, right?
Yeah.
It's straight now.
Yeah.
Not bad for 3 visits.
That's crazy.
Sit up for me, sir. Let's walk that off 2-3 times. Now, as you're walking, let's see how that. Awesome.
Way more centered. Oh my God, it's so nice to walk with my chest up. That's the biggest. That was the thing that was pissed me off the most, is that I had to slouch over and do all this weird stuff. Now I'm like,
Confidence, and then the confidence
Yeah,
comes
dude.
back, right?
really?
Back over here, sir. Shoulders, ears. Ears. Shoulders. There you go. Squeeze. Hand is good. Hands are good. Visit 3. We got full extension.
In the books.
I like it.